All right, so this week's outcome measure of the week is the TUG, or the timed up and go. This is a fantastic outcome measure, pretty much to use in really any setting that you're in, just depending on the patient's presentation. So it looks kind of at transfers, it looks at gait, it looks at balance, and it's really simple, easy to do. You don't need a ton of space. It's easy to have all of the equipment because all you really need is a chair and a piece of tape. And so all you do is you have the patient sitting in a chair. If they need an assistive device, you have them have their device nearby. And you just tell the patient, when I say go, I want you to stand up, walk to the piece of tape, which is going to be 3 meters away, so like 9 to 10 feet, and turn around and then come back and have a seat. So that's it. It's literally timed up and go and sit back down. So they stand up, walk to the piece of tape on the floor, come back and sit down. Try not to use a cone or something that they have to like actually walk around, because that can make them score more poorly because they have to go around it and they might trip on it, and that could cause some other issues. Whereas if it's just like a piece of tape or a line on the floor, you don't really have that issue. And you can let patients use an assistive device. I would make sure that you mark that when you're scoring it. And this outcome measure has tons of research behind it. There's tons of different cutoff scores depending on the patient diagnosis. I think the general cutoff score for community ambulators is 13.5 seconds for a fall risk. So if they score above that, they're considered a fall risk. But scores can kind of range between 10 and 15 seconds for being at a risk for falls, depending on the patient population. So I would definitely recommend looking up on the Shirley Ryan Ability Lab website. I'll put the link down below what the fall risk cutoff is for the particular patient population that you're using this for. But it's super easy. Sometimes I'll give patients a test run because I've had patients, they stand up and then they take a second and they kind of walk over, walk back, and then they fix, maybe their gown if we're in the hospital before they sit down. And that's kind of a poor representation of their actual ability to stand up, go down, and come back. However, if they do that on every trial, then that's going to be what their score is. But it's important to make sure that you start your timer when you say go, because that kind of takes into account how long it takes them to stand up, and that you make sure you only stop the timer once they're fully sitting back down, not once they touch the chair or something. It's when they're fully seated again. So that's the timed up and go. I'll play a quick video of a demonstration of it and put the scoring and kind of how I would interpret it for my co-resident Jessica, who we did it with a rolling walker. And yeah, it's a great outcome measure. It's very quick and easy to do. It kind of assesses gait, balance, transfer, so it's nice. It gets all of them, and it's really easy to set up. All you really need to do is be able to mark out that 3 meters, have a chair and a stopwatch, and you're ready to roll. All right, so this is kind of a quick example of what the TUG, or the timed up and go, might look like in the clinic. So we have Jessica here. She's going to be using a walker. I've marked out 10 feet from her armed chair, and I put a little piece of tape on the floor at the 10-foot mark. So I'm basically just going to tell Jessica, okay, what I want you to do is when I say go, I want you to stand up, walk to that dot on the floor, turn around, and have a seat, okay? I want you to do it as quickly as you can, safely, and don't go too crazy. And when I say go, I'll start the timer, and then once she's fully sitting back in the chair, I'll stop the timer. Okay. So whenever you're ready, and you ready?
Yeah.
And go. Good. All right, so Jessica got 19 seconds, which offhand I know is much slower than the fall risk cutoff, but we can also kind of note that she went around and didn't necessarily make a straight path. So this is also something that we could possibly give her another test at it, maybe give some more instruction on trying to make a straight, clear path. You are allowed to give a practice run for the TUG. But that's a quick example of how you would run the TUG in clinic, making sure that they are using an armchair. You're starting the timer when you say go, so you're kind of getting how long it takes them to stand up, make that transfer, walk, turn, and come back and sit down. So we'll talk about that a little bit more afterwards with the scoring. Thanks for watching. So that's the tug, the timed up and go. Hopefully you can start integrating that into your practice. Thanks for watching.